Please welcome the Aneurin Bevan University Hospital Board team, who will share their EQIP journey and improvement project with you based on achieving 90% of all 14 to 16-year-old children and young people with epilepsy will have been sent. Ready, steady, go forms.
We had the idea for the project was to try and make the whole transition process better, to make it more of a gradual process, perhaps over a number of years. And that needed some sort of structure for each patient. And so we decided to go with the Ready, Steady, Go transition program, which is the sort of structure and framework of questions that's come out of Southampton for transition across pediatrics, but there is a form for epilepsy. And then to gradually introduce these questionnaires at the appropriate stage. So there's process, but there's also judgment as well, of judging when somebody's right to start that process, and then gradually build it up, and for that to be kept a record of, that everybody can see. And then there's also then this final part of the pathway where we have to book a clinic, and we have to book them into a clinic and manage a waiting list, and then we have to have adult neurology involved as well. Of course, COVID has stuffed up the organising of a clinic where you could have 6 or 7 people at an appointment. Well, I'm having a bit of trouble trying to find out if we can go ahead with the August clinic. Have we got a physical space that we can do that? But we do have the waiting list set up now. But we have now these 2 clinics, a consultant-led clinic and a nurse-led clinic, occurring alongside each other every 2 months to start with. And that's on a Friday afternoon. That's the unfortunate bit, because clinic space is at a premium. So when you say, could I have 2 giant rooms right next to each other, you're obviously met with a limited set of options when you ask for that.
I think overall we were really pleased to achieve the 98%. So our aim had been for 90% of 14 to 16-year-olds to have had the initial Ready, Steady, Go paperwork within that age category. So we were really pleased to get the 98%. And in the process of that, like Joe has said, there's been lots of learning going on with different cycles of change. Yeah, we've been collecting data on how patients wanted, young people and families wanted to work through the transition paperwork. So that was the past voting that we did initially. And it was interesting to see that the feedback was that they did want email and sort of digital contact in that sense, which for us, we haven't been able to do straight off because we haven't had that set up. So for us, that's one of our future plans, is to get the computer technology to be able to do that. Although during COVID, we have been able to use email that bit more in order to get the forms out to families to have a look through. And then we've been using telephone consultations to chat through. So we realized that we needed to really break that down in terms of the young people's needs. So the standard Ready, Steady, Go form that we had initially looked at wasn't appropriate for everybody. It wasn't meeting the needs of some of the young people. So we adapted that for our young people with complex health needs, complex needs. So we used it as a template and a framework to follow the Ready, Steady, Go framework, but we just adapted it to meet the needs of those young people. And that seems to have gone really well. So a lot of that is liaising with the families, but making sure that the young people have a voice in completing those forms. And then we've also used the easy read Ready, Steady, Go forms, so yeah, it's been about being able to look at our cohort of patients and then identify which forms are appropriate for the different families, which a lot of that is about knowing the families and knowing the young people. But we found that quite not time consuming, but just an extra part of the process. So it's not that they can just be sent out to all the families just straight off. So that takes a bit of time to assess. But one of the biggest things that we've realized as we've gone along is that the forms are time consuming in completing with the families and the young people. But hopefully that's been a positive thing, because it's given the time for the families and the young people to chat through their transitional issues, signposting them to, for example, websites like Epilepsy Action, Epilepsy Society. Yeah, so that's been a helpful way to spend time with the young people, but it is time consuming. But that's been part of the nurse-led clinics that have been set up.
You know, how we deal with transition could be said to be a quality standard, but I think the key thing that's come out of it is the amount of time it takes to do well and to do it properly. And it really, it's another argument for preserving our epilepsy specialist nurse resource, really, which, although we've had some changes in the team since we first met, we have at least got agreement that those sessions will be replaced, which is a step forward